Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
By now, we've all heard that there is a new strain of the COVID-19 virus that is out there, and is coined the UK strain. And a lot of focus has been put on this strain because of the perception that it is certainly much more transmissible, hence more contagious, but yet they're not able to definitely show that it is creating a higher mortality rate, meaning that the original strain of virus that was going around that was infectious was infecting people and killing people roughly at about the same rate as this new strain, which is infecting more people, but perhaps killing less people. So let's talk a little bit about that in terms of what that actually means when we talk about a variant or a mutation within a virus, and why this can be incredibly problematic when we're looking specifically at COVID-19 and what we need to make sure that we're doing throughout this time. So I am Amanda Williams, MD, MPH, and let's talk about mutations and the genetic changes that actually occur within viruses. We know that viruses as a whole continuously change as a result of just basic genetic selection. So they're undergoing these different subtle genetic changes or mutations, and through these mutations, then we can end up with a variant or a strain that actually is presenting in perhaps a much different way than the original virus. And so, not to get too overtly complex in virology today, we can think about the influenza virus, for example. We know that from one season to the next, there are new strains. And so it's always based off of, say, the flu vaccine. They're always trying to predict what is that new mutation that is going to occur. So they're trying to forecast that. Well, we know that the mutation rates of viruses certainly are quite high. And when we look at RNA viruses in particular, which is what COVID-19 is, or coronaviruses are, those are RNA viruses. They have a much higher mutation rate. And so this is important to kind of understand that being that RNA viruses seem to mutate at a much greater rate, then we can look at it and say, okay, well, if we have a virus that is presenting differently, then how is it that we can actually track it in terms of its infectiousness? And that's exactly what they are looking at now. We know that the virus is replaced by many, many different generations of itself. And basically, this is what a virus tends to do, is that they change and they evolve many, many times. And this is not a defect within the genetic coding of the virus. This is technically just the way that viruses work. So when it comes to their reproduction, viruses are not very efficient, and the speed and the scale of their replication come at the cost of basically being very effective, one would say. And so when we think about that, we can then recognize that these viral mutations that we are going to continue to see within the coronaviruses. And keep in mind, the UK strain, this is just the one that they're seeing, hey, it's mutated enough that its transmission rate in terms of its infectiveness is gone up significantly from prior strains of COVID-19. Now, when we started looking at the different variants of COVID-19, close to a year ago, there were certainly different variants even then, but the rate at which the genetic information or the coding information was changing all seem to kind of have the same patterns. And so this one is certainly the one that scientists really have gravitated onto, because they are recognizing that indeed this one has made significant shifts in its genetic operations, which makes it that much more transmissible, hence more infectious. So this is why we have this particular problem right now. Now, when we look at overall, population density and virus strains, we can see how different regions can be impacted differently. And we can go back to the beginning of this pandemic and we can see the rate of transmission in, say, New York versus California, or on the West Coast originally. We know on the West Coast, yes, you were seeing rates of infectiousness and mortality, but it wasn't at the same rate as what you were seeing in New York City. And so are we looking at a population density issue? Yes, that's one component of that, but we're also looking at those variants. And so we know that the initial strains that were originally on the West Coast of the country last March were these strains that didn't have that high rate of transmission. And the strain that ended up in New York had a higher rate of transmission. Now we have this brand new strain, which has a remarkably high rate of transmission, which makes it quite alarming. And as new and more transmissible versions of COVID-19 continue to appear and will continue to appear throughout different parts of the world, as well as, right here in the United States, this is why we really need to make sure that even when it comes to, say, the vaccination, that the vaccination is still going to be working and effective in terms of the original genetic makeup, and that those variants that have occurred in terms of the coding mechanism hasn't altered to such a degree that it makes the vaccine basically null and void, which is what you can see sometimes with the influenza vaccine. So there's a lot of heavy science that goes along to this. But one of the things that we know for sure, and now that we've been researching as a scientific community for over a year now, the rate and the spread of COVID-19, the one thing that we certainly can hone in on is how effective masking and social distancing can be. And when you start to see a waning of this behavior, once again, we start to see this spike. And that's where the worry is with this new strain of virus, is because of the fact that people have COVID fatigue. And I certainly understand that. But we also have to recognize that now that you have a new strain that's out there that's really, really infectious, you have to make sure that you are taking every possible precaution that you can during this time. Now, there are more and more studies that continue to come out that are shedding more light onto COVID-19 and the different variants that are out there. One thing that came out recently, and this was in the PLOS One journal, which I thought was really quite interesting, and that was that males of all ages appear to be affected by COVID-19 at a greater rate than females. So this is something that certainly will allow for more detailed research into this. But PLOS One is a very large journal, and they were looking at different data that was available through Houston Methodist Research Institute. And they were able to identify different populations and subgroups within those populations, looking at the levels of disease and the vulnerability of different groups. And what they were able to detect overall was that those who were testing positive for COVID-19, for the SARS-CoV-2, were at a greater proportion, a significantly higher amount of males as compared to females. So it is at this point in time looking as though males seem to be more likely to actually contract the SARS-CoV-2 virus, and also that they are indicating that they have a poor clinical course and outcome. So when females are getting it, the susceptibility is still there and the disease progress is still there. But this is something that certainly they're going to be looking into in terms of further investigation. And I think that's important to know. Now that we're looking at this UK variant that is now starting to traverse across the United States, and the University of Texas at Austin, they were looking at the different mutations and talking about how the mutations themselves is what is making the coronavirus more contagious. Now, sometimes you see this in an opposite way with different viruses, where the more mutations or the mismatching of that genetic code material actually lessens its transmission rate. But we're not seeing that with COVID-19. So they were looking once again at 5,000 different patients who were COVID-19 positive in Houston, and finding that the virus that causes the disease was accumulating greater genetic mutations than they even recognized before. So now that they are able to take an individual who has COVID-19, look specifically at more detail of that actual viral load within their system, they're able to decipher this down, and they're seeing a much greater amount of mutation occurring within that spike protein. So we've all now seen what the coronavirus looks like, and it has those little spikes off of it. They're starting to see more and more of the mutations occurring within that spike protein, and that's what's required for the entry into the actual cell. So the more that virus is mutating, this is where we start to see the issue with the transmission rate. And that's what they've recognized with the UK variant, is that the spike protein mutation has led it to have easier entry into the cell than the previous variants of COVID-19. So like I said, a lot of this is very heavy and technical scientific information, and I don't want to get into the the D614G mutation being more common as opposed to another variant. But what we know about this virus is that it continues to mutate as it's ripping throughout the world, and it is incredibly problematic. And for me, coming from not only a medical but also a public health background, I have been worried about this for a long time now. When the pandemic initially started, I had a tracker where I could see the different variations and the mutations and where they were occurring throughout the world. And then you could correlate that up with, infectious rates and mortality rates. And it was, kind of holding steady state, and you were seeing the different mutations, but you weren't seeing a real shift. But now this is where the concern comes in, is if we have this much greater rate of virulence held within those spike proteins that can now easily enter into the cell and then can be transmitted from one person to the next in a much greater percentage, this is where the problem hence arises. And so this is why I kind of wanted to focus in on this, because we get a lot of questions like, well, do I have to do anything different? And my best advice would be, number one, make sure that you're doing everything to support your immune system throughout this. Don't look at it as like, this is no big deal. I always say, this is one of those things where you don't even want to get it. Don't even risk saying, I don't care, I have COVID fatigue. I'm just, going to be a little bit more loosey-goosey now. Definitely not a good idea. I would certainly say continue to do the things to support your immune system. Make sure that you are every single day taking things that we know the immune system needs to function properly, such as vitamin D, vitamin C, zinc, magnesium. So even at bare minimum, taking a multivitamin. I would certainly encourage people to be using Immunity HX right now, which is giving you an adequate amount of vitamin C, vitamin D, and zinc. But you also want to make sure that you are still practicing proper social distancing, that you are limiting your exposures in, big, large group settings, certainly. And obviously, if you are going to be going out, that you wear your mask. And this is not a big thing. I always kind of use the analysis like, well, okay, if you went into a store and they told you, okay, in this store, 2 people out of the 100 have head lice. Well, most people would be walking around trying to stay as far away from the other, people as they possibly can, just in case, that lice jumps into your head. Well, you want to think about COVID-19 in that same way. There is no point in exposing yourself to this virus because of just your lack of caring. You should want to just wear a mask, protect yourself, protect others, keep that social distancing. We know that this virus will continue to mutate. We are seeing that UK variant is highly transmissible, meaning more people are going to be getting sick. The problem is, what is the next variant? What is the next change that this virus will make? And it will. That it switches over from not only being greater transmission, but a greater virulence, meaning it's going to produce more significant symptoms and a potential significant spike in mortality. So be sure that you are doing the right things, eating healthy, try to avoid, the standard American diet, avoid sugars. We know one thing about our immune system, it will get wore down if we are putting bad nutrients in, because the immune system is fueled by those nutrients. So we have to make sure that we have all of the vitamins and minerals at hand so our immune system can be at the ready. So if in the event we are exposed to, hopefully not COVID-19, but any type of a virus, that we have the ability to give our immune system the opportunity to fend it off. So that is all that I have for you for today. I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. And we will see you next time for another episode of the Invite Health podcast.